So welcome everybody to our information session tonight. My name's Andrew, and I thank you all for coming here tonight. We'd like to acknowledge the land we meet on today is the traditional lands of the Katina people, and we respect their spiritual relationship with their country. We also acknowledge the Katina people as the custodians of the greater Adelaide region, and that their cultural and heritage beliefs are still as important to the living Katina people today. Before we start, a couple of items of housekeeping. I'd ask you to put your phone on silent or turn it off. If you need to use the toilets during tonight's session, you can go outside and turn left and walk to the end. If we need to evacuate in the case of an emergency, we need to make our way downstairs. You can either turn left or right to head down using the stairs and then assemble across the road. Now, while you're seated, you can take your mask off. Feel free also to leave it on if you feel more comfortable. When you're moving around, though, you must have your mask on. And please remember, if you're eating or drinking, make sure you're sitting down when you're doing so. During today's session, we are taking photographs and we are taking video. So please be aware of that. And if you would not like to be photographed or videoed, please make sure you let us know. As you sat down, you would have seen there's a survey on your seat. Please hold on to that and fill it out at the end of the session. And then before you leave, you can leave it on your seat and we'll collect it at the end. I will let you know that, as I said, we are recording. And we will be sending you a copy of this presentation and the session itself after this for everybody who has registered. So if you've registered to come tonight, you will receive a copy of it, which you can share. So I'll let you know the format for tonight. First of all, we'll start with an update on COVID-19 and COVID-19 vaccine situation here in South Australia. Then our speakers will provide answers to some commonly asked questions. And then we'll open up to a Q&A session, question and answer session, where you can ask questions to our panel here. So I'll introduce our panel. We have, starting from my right, Professor Nicola Spurrier, who's the Chief Public Health Officer in South Australia. Then Dr. Lease, who's a Deputy Chief Public Health Officer. Then we have Dr. Seshu Boda, who's the President of the South Australian Indian Medical Association. And then finally, we have Professor Katina, who is the Executive Director of Wellbeing SA. So I would invite you to please welcome our speakers tonight.
Thank you very much. And it's just wonderful to be here this evening, and I'm really impressed with how many people have come, because I know you've all got families to go home to and probably somebody cooking dinner for you. So, after hours, I really think you must be thinking about your community and the well-being of your community to be here this evening. So I just will also acknowledge that we're meeting on Katina land and pay my personal respects to elders past, present and future. So I'm going to start with just a little bit of an outline of where we're up to with COVID in the state, just to set the scene. And then I'm going to pass over to Lease, and then I'll come back and talk through some of the vaccination issues. So I'll be covering a few things that you might be wanting to ask questions about, because we've already got quite a few frequently asked questions that come through. So I'm going to try my best to answer those. And then, of course, it's going to be wonderful to take your additional questions. So let's get started. So let's talk about what's currently happening in South Australia. So really, we have been incredibly fortunate in our state, because I don't want to say to you we haven't had the pandemic, but in a sense we haven't. We haven't had a large wave with the experience like New South Wales or indeed Victoria. Victoria's had, of course, those two very significant waves right in the middle of their third wave. And we've been very fortunate in South Australia that we haven't had it. And it's really been because early on, we could see what was happening in the rest of the world, and we wanted to have time to get our healthcare system up to scratch, our contact tracing up to scratch, and as much of the prevention that we could put in place. And of course, we shut the international borders. But the virus is very sneaky, and particularly the Delta variant, very, very infectious. And it's really no surprise that it got into New South Wales. And again, no surprise that it's come across to Victoria, because as humans, we need to move around, we need to see each other. And so as people move, the virus also moves. So we're lucky that we got on top of the Parafield cluster and then the Modbury cluster. And because I've got Katina sitting here, I do want to personally acknowledge that Katina was the person who was running our communicable disease branch and did all of that fantastic contact tracing with the Parafield outbreak, and has also set us up for the future in terms of our system and strategy here in South Australia for contact tracing. And that was not your day job, Katina. She was really the Executive Director of Wellbeing SA, but we've all had to move across and do a lot of additional work in the Health Department and in other government departments because of the pandemic. So as you can see on that map with the bright red, we are really very close to having an outbreak here as well. And so we've got a very short time to get ourselves completely covered with vaccination. So we've got other things that the department's done. I've talked about our contact tracing system. We're looking at making sure that we've got quarantine facilities for people. We're looking at the restrictions that we have in place at the moment. And some of you will be thinking, why on earth have we still got restrictions here? We don't have any COVID. But unfortunately, we have had exposures. So we've had cases coming across the freight drivers and also a miner. And as you can see on the map, we're very close to having an outbreak. But what our intention is, and my intention would be, is that we try and have the disease come into our state on our own terms and in a controlled way when we have got ourselves in the best situation we possibly can be in, and that is being vaccinated. So, and I just also wanted to say, in terms of having the border around our state, maintaining that is incredibly difficult. So we have police on those borders checking people who are coming in. And then many of you will have friends and family in the other states. My daughter lives in Canberra and she's only 22. I really want to see her, you know, but because of the borders being shut, we don't have that fluidity of being able to move and see our families. And at the moment, we've got over 6,000 people waiting for their exemption to be looked at so that we can bring those people safely into our state to do home quarantine. And we still have to put the monitoring and the testing around those people. We are looking forward to the day when we don't have those borders. And I know other states might do things differently, but you can see as we're so close to those two eastern states, it is an inevitability. So the next slide is just to really point out that there are three things that we have in our pockets to deal with the pandemic. And when our turn comes for the disease to come into our state, we need to make sure all of these three things are up to standard and are up to scratch. So we'll deal with vaccination in a minute, but I really wanted to draw your attention to the fact we can't just rely on the vaccination because nothing is 100% and not 100% of people will be vaccinated. So we're going to need to continue having our public health and social measures, and those things do include continuing with the hand hygiene, continuing with the physical distancing, wearing masks. I know that not everyone is that happy about masks, but it is a very good public health measure, and Chris will talk a little bit more about that. Unfortunately, we will continue to have some restrictions in terms of our activities so that we don't have as many people intermingling with other people, because that's one way of keeping the transmission of the virus throughout our community lower. And I know that's difficult, and I acknowledge that that's had a significant impact on businesses. But on the other hand, if we have a lot of people getting sick in hospital and indeed dying, that also has a very significant effect on our economy. And the last one there, staying home when sick. Equally important. We will continue, just to make it really clear, we will continue to have public health restrictions in place. And at the moment, I'm trying to work out using mathematical modelling how that aligns and how we work that through alongside the vaccination. And then the last pillar in our public health toolkit is testing, tracing, isolation and quarantine. We call it TTIQ. Now, the contact tracing, yes, that's a responsibility of our department, our health department, but we can't do that contact tracing if we don't know if somebody's a case. So testing has to be right up there. So we need to have people continuing to get tested if they have any symptoms at all, even if they are vaccinated. Because as soon as we get a case in this new world, when we have the disease in our state, we will need to really go hard with our contact tracing and get the close contacts into quarantine. And that includes, of course, continuing to have that QR check-in. So people might think, oh, look, when everyone's 80% vaccinated, we can do away with all that stuff. I would love to be able to tell you that that's the truth, but unfortunately, the modelling that we've got and the experience of other countries such as Israel, Iceland, US, Canada, who have high vaccination rates, they still have to continue doing these activities because otherwise the virus is so infectious, this Delta virus, that it will just whoosh up again and get out of control. And what we're trying to do is keep it at levels that don't overwhelm our healthcare system so that people who do catch COVID get really good healthcare and the doctors can manage the numbers coming through the door. So sorry if that's bad news to anybody, but it's just the reality. But of course, the more people we have vaccinated, the less we will have to do with those other two things. That's why vaccination is really important. So I'm now going to pass over to you, Chris. Yep. Thank you.
Thank you very much, everyone. I'll just talk very briefly about some of the individual things that we can do or are already doing, which are so important to help us sort of maintain our good position. Whenever I get asked about why South Australia has been so successful, of course it's down to leadership, of course it's down to systems, but I think in terms of the South Australian community, they have really got behind a lot of the things that we've actually asked them to do and continue to do so. I know there's a lot of fatigue coming in. People are over it. I'm sure we all are over it, but maintaining some of these sorts of individual behaviours and actually championing those throughout your various communities is a really important piece of the puzzle. As Nicola pointed out, we've got sort of these pillars that we've identified. We've got sort of down one end, how our systems respond if we do see a case. We've got vaccination up the other end. But that's central, one of these sorts of key behaviours that individuals can do to actually, really reduce the risk of transmission if we did see an incursion. So I want to spend a bit of time on just sort of talking through that. And one of these is the wearing of a mask. And we've been very pleasantly surprised at how the community's sort of taken to that. It's not something that South Australian community did early in the piece. If you sort of contrast it with friends and family over in Victoria, when they could come across, they were often quite surprised at how there was little to no mask wearing. But as we saw around the Modbury outbreak, is once people started to wear masks and they become a bit familiar and they are irritating, it is an ask. I spend a lot of time in fog because of my glasses with the mask. But really, it is one of those individual behaviours that can be so important in disrupting the potential for transmission. So, when we look at what the studies tell us, a 50 to 80% protection, which is fantastic. And of course, this diagram shows you that the best way of doing it is if we all do it. And that's really where we want sort of people to become a bit more familiar with, how we do this, particularly in situations where you can't socially distance. They become even more important. So as I say, I'm very encouraged the community sort of taken to the mask wearing, which is fantastic because again, it's one of those individual behaviour things that we can actually, each and every one of us can actually do to help maintain a degree of protection in the event that there was an incursion. Of course, the mask wearing is only as good as if you do it properly. I often talk to my children about wearing it just underneath their nose. It's got to be over the face, over the mouth and nose to actually confer that level of protection. Probably goes without saying, but I do think we start to see people trying to make it the best way possible, and sometimes that will make it unfortunately not as effective as it should be. So The other thing is, it's very tempting to keep moving it, and I do it all the time myself. I have to consciously stop myself. It's, sort of put it in position and just leave it there rather than sort of touching your face constantly, because there is the risk as well of, if you were carrying COVID, for example, that transmission. So again, it's something we can do as individuals which will help not only us and protect us, but also protect our families and communities. The other thing I'd like to emphasise as well, the importance of COVID testing. One of the real challenges that we have about COVID is, of course, asymptomatic infection or very low symptoms or low-level symptoms that people might experience. So it's critical that we know what's going on and people get tested if they have any symptoms at all. We are very fortunate to have an excellent testing system, widely available. And really the turnaround times are fantastic, and we do have a scalable system so we can make it expanded as we need to. Testing is something that sort of tends to go in a few waves. As we saw around the Modbury outbreak, our testing system was flooded. We had a fantastic response from the South Australian community. Big lines, unfortunately, long waits, but it just showed, how the community got on board about, being very concerned about Modbury, making sure we knew exactly what was going on. We really want high levels of testing so we know exactly what's happening in the community, because if there aren't, if they're asymptomatic people possibly transmitting the disease, that's going to be a real challenge. We might be 3 or 4 generations into transmission or cycles of transmission before we know what's going on. So it's so important, to get tested and encourage people to get tested as well. I think for a lot of people, and we do see a lot of respiratory disease, colds, those sorts of things happening at various times of the year, hay fever, that sort of year. But if there is any doubt, go and get tested and encourage that. It is free. It's a little bit uncomfortable at times, but by the same token, it's really important to protect ourselves, our families, and our communities. And finally, and it's sort of at the response end of the equation, using COVID-safe check-ins. We really, really, really need people to take the time to check in when they see the QR codes. This gives us the best ability to contain a situation. If we did have a case come in, if we know exactly who was in close contact with that case and we can round them up quickly, get them into their quarantine, we've got the best chance of containing spread. And when I talk about those sort of cycles or those generations of transmission, if we can stop that at the first or second, we've got the best chance of stopping an outbreak. The COVID-safe check-in allows us to do that, because essentially it gives us an automated system. So if you have been in that place, you'll receive a text message, and we're talking sort of minutes, not days and weeks. As we saw with the truck driver incursion, or the cases that went through Port Augusta and Seshu, not a lot of people checked in. So we had a real challenge of identifying who was actually at those places at the same time as those cases. This is the sort of thing that we want to avoid. That time is of the essence, so we really want people to check in. It is important, it's very protective. It's only for contact tracing, but it's so important to allow us to do that quickly, because if we can get the vast majority into quarantine quickly and then start working through, and we might release people or risk assess them, those sorts of things. Again, that gives us the best opportunity to sort of contain spread, so we're right on top of it. So those sort of things that I've just described, again, they're individual behaviours. It's a bit like vaccine, and Nicola will talk about that in a second. But it's those important individual behaviours which will give us the best chance to keep on going as we are. If we do see an incursion, to be able to protect ourselves from it, but also respond to it if we need to. So I'll leave you with those thoughts. But again, if the appeal is, South Australia has done such a fantastic job. It's people like yourselves that have put us in that position. If we can continue those behaviours, we'll continue to be in that position. So over to Nicola for vaccination.
Thank you. And I'll just, when you said, Chris, that when we've got a positive case, we're looking for the close contacts, we'll round everybody up. I just wanted to tell you we don't actually literally round people up. We do it in a very nice, personable way because we treat everybody with respect as humans. And and I did want to point that out because when we've had contact tracing, it is actually pretty stressful for people. And if we have a case and then we have to find all the close contacts, and actually, of course, this has touched the lives of many people who have got different ethnic and cultural backgrounds. And so we have had to use all of our abilities to develop those relationships with our contact tracing team and use interpreters and such like when we've needed to. But we're very, very mindful of those sensitivities. And also the fact going forward, we will need people to be able to quarantine and to isolate. And not everybody has a 4-bedroom, double-storied home on a large block, obviously. And we are looking at what we can do to assist people to quarantine safely if they've got a large family or they're in a shared accommodation and the like, so that we can all be safe if we need to. Right, so I'm going to move on to the important topic of vaccination. So we're doing pretty well here in South Australia. You know, we've never had to vaccinate the whole adult population really quickly. So, if any of you have been to our large vaccination clinics at Wavell or Playford or Noarlunga, it's pretty impressive. All of a sudden, we've got all of these cubicles set up. We've taken nurses out of our hospitals, and then all of these retired nurses have come back, been retrained, put their hands up and have come back to help as well. And we're now getting student nurses to come and help as well. So we've given, you know, 1.5 million vaccine doses, which is absolutely incredible. And so more than 62% of our population, 16 and up, have had at least one dose, which is fabulous. But I'm more interested in the 2 doses because if you only have 1 dose, it's not as protective. It gives you something, but it really doesn't give you everything that you need. And so we've got 44% having had the 2 doses. And there is this one group that when I see the data by age, I do get a bit worried about, and they're the people 60 and above who have probably had AstraZeneca and are worried because of AZ. And those are the people I really would like to have a second dose, because if you were going to have a problem with the AstraZeneca, you would have had it with your first dose. So it's absolutely perfectly safe for those people to have their second dose. What I worry about is that when we have COVID in our state, they're not going to be protected. So that's an important message out to communities. But we now have a choice, and we really are very fortunate. When we were sitting as Chief Health Officers last year, and we were thinking about this dreadful pandemic and what were we going to do, we were hopeful that we would get one vaccine that was probably at least 50% effective if we were lucky, but we've ended up with multiple vaccines which are much higher effectiveness than 50%. So we have Pfizer for 12 and up, AstraZeneca for 18 and up, and we now have this week, the Moderna has arrived in Australia and will be coming out in pharmacies. So we're very lucky to have a choice, although some people have said to me, it's so confusing, why have we got 3? That makes my head spin and I don't know which one to have. So I appreciate that it has made it difficult and challenging for some people, but of course our government needed to invest in a number of options in case some of them didn't come through. And Novavax was another one that we have lined up, but it's a small startup company. It's probably a very good vaccine, but they just haven't been able to produce enough, so we haven't had that arrive in Australia. Novavax, yeah. Mm-hmm. I can't tell you the country because I can't remember, but it's quite a basic technology and it would have been a good vaccine. The trials were all fine, but it's just that we haven't had the supplies, yeah. And I think we're good at 3 anyway, yeah. No, it won't have come in for approval yet, yeah. We'll just have to wait for the future. But at the moment, we are going to have enough vaccines, absolutely enough vaccines for absolutely everyone in Australia with these 3. So now, because they're different vaccines and they have a slightly different technology and they've been tested by different companies, there is a different dose schedule. And again, that does sometimes get people a bit bothered. But with the AstraZeneca, the recommendation is 12 weeks. With the outbreak in Sydney, Atagi went back and said, you can have it closer in the middle of an outbreak. You're better to at least have had your 2 doses, because if you don't have your 2 doses, you're not going to be covered. So it's not quite as effective putting the dose down to 4 to 8 weeks, but when you're in an outbreak, it is much better than not doing it. Yeah. No, it's always been 12 weeks. Yeah. And then Pfizer is 3 weeks. And when we did our session earlier today, somebody asked us if you don't have your 2nd dose because something's happened, you might have been sick or you forgot, can you still go and get it done? Does it matter? Absolutely, you can get it done. And I gave people the example of 2 people in my family. My son, who's 20, he had his Pfizer dose. The day he's due his vaccine, or the night before, he said, "Mum, I'm not well, I'm coughing," and he has asthma. And he actually had bronchitis and needed antibiotics. So I said, cancel, you can't go in when you're sick. He rebooked 2 weeks later. He's now fully covered with 5 weeks apart. It will make no difference for him. And my mum, who's her 80th birthday tomorrow, actually, she's a very active 80-year-old. She was bushwalking and fell over and broke her leg. So that meant her AstraZeneca 2nd dose got pushed out, but her GP kindly dropped round and gave it to her when she was recuperating from her operation. So again, it was a few weeks late, but it made no difference. So again, if people have missed, they've forgotten or something happened, they don't have to go, "Oh no, because I didn't have it the right time, it's no point having it." Just go and get it done, and it doesn't matter. Now, whereabouts do you get the vaccine? So there's many places, and Vishnu is here as a GP, and he spends a lot of time talking to his patients and giving them vaccines. There are some GPs that have done the training, and you have to have done the training to be able to give the vaccine. And Vishnu told us before that there is information with each practice as to whether those GPs are giving the vaccine or not. Then, of course, our pharmacies are coming on board. We have our large vaccination clinics. And then the other one I'm pretty excited about are our mobile and pop-up clinics. So Flinders Medical Centre had a mobile van going to some of the mosques in their local area. I was at Paraka this morning, you know, the fruit and vegetable market, and that's now been opened up as a vaccine centre. When they get in early, 6 a.m. or whatever, to bring in the fruit and veg, everything's finished by 9 o'clock, and then they open up for community vaccines. And they will allow some walk-ins there as well. It's better for booking, but they do allow a small number of walk-ins. And we're looking at more and more places where we can have pop-up clinics, making it easier for people to get to the vaccine, for communities to get to the vaccine. And we've had a couple of dedicated clinics for the aged care and disability sector, because those people have to have, it's mandated, they can't go to work without the vaccine now, and that was last Friday on the 17th. They all had to have had their vaccines. Yeah. No, residential. So residential aged care, it's mandated vaccine, yeah. Of course, we would love all people working with the aged care sector to be vaccinated, because that is one of our most vulnerable communities. Okay, so here are some questions that Chelsea's put together. Chelsea, if you want to wave your hand, this is our head of our comms department, and she has been fantastic at setting up our community events and putting these, collating all of these questions. So these are some of the things that people worry about, and it's maybe part of that vaccine hesitancy. So people have said to me, and if you've probably read on social media, how can these vaccines, how do these vaccines get approved? You know, it seems to be a bit of a rush job, and they suddenly turned up. How do we know that they're safe? So in Australia, we have the Therapeutic Goods Administration, called the TGA, and every single medicine that comes in and is approved and is on the shelf here has to be TGA approved. And that also includes other things, so other health goods, such as, say, a new hip replacement or a new device that's needed in healthcare, all has to go through the TGA. And the TGA just didn't pop up yesterday. The TGA has been around for many, many years. It has a very standard process that they go through, and the vaccines have all gone through that very, very stringent process. And you asked me about that one as well, about TGA approval. So they would not approve a vaccine for use in Australia unless all of the dots were dotted and the T's were crossed. And I feel very confident when a vaccine has been approved that it's meeting that very high standard. Now, that can't be said for every country in the world. Some countries don't, they're not lucky enough to have something like the TGA. And so I can't speak for other countries, but in Australia, I'm very confident about the vaccine safety. Now, this is a question that we get. How do these vaccines actually protect people? Yes? Yeah, sure.
What was the sample that you used, and what is it compared with the used in UK or America?
So I have a lot of things in my head, but I don't carry around that level of detail, I'm sorry. But what I would suggest you do is ATAGI has everything up front on their website, and TGA I should say, and you can go to the TGA site and have a look through their approval process, and they will have listed all of the studies that they have included in their assessment. And that's all there for public information, but I can't provide that for you tonight, I'm sorry. Yeah. Okay, so this is about how do vaccines protect people. We've used vaccines for many years, and all of you who have kids will have had your children vaccinated, I'm sure. And so whilst the mRNA vaccine uses a new technology, the basic premise of a vaccine is it introduces your body safely to a component of a bacteria or virus so that your body has a little mini reaction to it, and the killer cells that fight infection and also the cells that produce antibodies learn about that particular protein. So when that protein comes into your body again in the form of the actual virus, in this case the coronavirus, your body already knows what to do. And so the killer cells get out really quickly and the antibodies get out really quickly and smother that infection and get rid of it. Now, I was thinking about this when I gave my earlier presentation, because I'm thinking about how do I explain boosters. You know, when you learn a new piece of information and you might read it once and then you put it away, and you read it a second time, you're much more likely to remember it if you've had some repeated exposure with that bit of information. And the same is with our immune system. So that's why a number of vaccines, and indeed the COVID vaccines, need that double shot, because the first one gives your system a little chance to learn about the virus protein, but giving the booster, it really commits it to memory. And there are actually cells called your memory T cells that remember about this protein so that when your body comes across COVID virus, they activate and you get on top of that infection. So that's basically how vaccines work. Now, this is a question about how effective are the vaccines. So as I said last year when we were at our meetings with AHPPC and looking at possibility of vaccines, we were hoping that we would have something at least 50% effective. But we've been very lucky to have vaccines that are even more effective than we even imagined. So these are the percentages for Pfizer, first and second dose and first and second dose. And it just shows you how the second dose is really very important. So for the Pfizer, you get with one dose a 71% reduction in chance of death, but it's up to 92% with your 2 doses. And similarly with the AstraZeneca, really a significant improvement in reducing hospitalisation, ICU admissions, and your chance of death. And when the vaccines were developed, the studies that were done by the companies looked at these as the outcomes, because they're the most important thing when you give a vaccine, that you're going to reduce the harm from the disease. But in addition to this, at the beginning of this year, we were thinking it's going to be impossible that this vaccine actually stops people getting infected. And it would be very unlikely it stops the virus being transmitted to other people. but actually these vaccines have done that as well, which we are very pleased about. So in addition to having that effect on individuals, the vaccines reduce your chances of actually getting infected, and that might be in the order of 60 or 70%. And then the remaining 30% of people that do get the infection, even if it's not very severe and they're not that unwell, it reduces those people's ability to pass it on to somebody else. And that's why it's made such a big impact in controlling the disease. And it's been, of course, for us, a bit academic watching New South Wales, but actually for the people living there, it must feel wonderful seeing those numbers not continuing to rocket up as they get those higher vaccination rates in some of their communities. The other thing just to point out with the vaccine effectiveness as another example is you'll remember in Victoria last year, we had so many elderly people that died in the aged care facilities there. This year, with New South Wales and Victoria, nothing like it. They've definitely had outbreaks in their aged care facilities, but they haven't had that high death rate. It is the vaccine, because there's such a high proportion, not only of staff have to now be vaccinated, but a lot of the residents, you know, over 75% of residents have been vaccinated as well. Now this one is a good question as well. How come they were developed so quickly and approved so quickly? There must be something wrong with them. So there's a couple of things behind this. Basically, with the worldwide pandemic, we haven't experienced it, but lots of countries have. Such a huge impact on their economy, lockdowns, dreadful impact on their social, mental health, and people just overwhelming their healthcare system, and so many deaths. So because of that, there was a lot of funding that was put forward from philanthropy, from governments, because this is the way you can really protect your community is through vaccines. And then the other thing is, when you're a researcher, and Katina and I are both been researchers, you know, you sometimes keep your sort of ideas to yourself a bit, you know, because you're a bit competitive as a researcher. But in this instance, everybody worked together. The research and scientists all said, we'll work together, which lab is doing what, come on, let's share our ideas. And we had that in Australia with a number of, we've still got people in Australia actually working on other COVID vaccines for the future as well. And we also had new technologies. So this was the mRNA technology had already been developed, and so was ready to go with this particular virus. And then the other thing, which I just find absolutely amazing, is that usually when you're running clinical trials, you put out a Facebook message, come on, join in my clinical trial, and you might get a few people joining up. But with this, everybody wanted to join the clinical trial, not because they were desperate for the vaccine necessarily, but because they wanted to be part of solving this problem for the world. And we had thousands and millions of people putting up their hands and saying, we'll be part of this clinical trial. We know it's a new vaccine, but you know, this is look at what is devastating our country. What else can we do? So the most important thing here was that no shortcuts were taken. Every single step that you normally do with a vaccine development was done. The phases of the study were done, the trials were done, and it was reported fully in peer-reviewed journals and has been reviewed, as I said, by TGA. So there were no shortcuts. Now, this is another question, and I think you already know the answer to this, so I'll ask you. If you've been vaccinated and you get sick, do you need to have a COVID test? Good, yes, excellent. So you can still get the infection and you can still pass it on. And we, as I said at the beginning, will need those other pillars of prevention. So I definitely will need to know when we have the disease in our community that people are still getting tested so we can do the contact tracing, because we need all of those pillars. So I'll pass that one. You already got a big tick for that. Now, what are the side effects? So many of you will have been vaccinated, so you will have already been told what the side effects are. If I go back to how a vaccine works, your body is getting primed. It's learning about this little protein. And so you might have felt a little bit fluey, maybe a little bit of a fever, chills, muscle ache and pain. And many people have a bit of a sore arm. So they are very common side effects. But actually, many people don't have anything at all. And my whole family's now vaccinated. My 13-year-old got his vaccine on Sunday and he's not had any side effects. In fact, he played basketball that afternoon. I did say, is your arm a bit sore? Will you be all right? He said, what are you worried about, Mum? And he managed to score more goals than any of the other kids in the team, so he was fine. There's many people that have no side effects at all. Now, there's two very, very rare, more serious side effects, but as Vishnu and I know, anytime we write a script for someone with any medication, there's always a potential side effect. And so with the AstraZeneca, there is the TTS, which is this clotting disorder. Again, it is very, very rare, but it tends to be in younger people more than older people, which is why we had the preference for younger people to have the Pfizer. Pfizer has an opposite issue. There is, again, a very, very rare inflammation of the heart muscles with Pfizer, and the opposite is it's more likely in younger people than older people. But again, it's very rare, and the cases have generally been promptly diagnosed and people have got over it very quickly. But we're not hiding the fact that there are these side effects, but we need to see this in the context of what it's like with COVID, and quite frankly, you can get muscle inflammation with COVID in a much higher rate than with the Pfizer vaccine, and you can get blood clots with COVID in a much higher rate than with the AstraZeneca vaccine. So you really have to be looking at the side effect profile versus the benefits. And of course, in one way, we have been a victim of our own success in South Australia, because people are wondering, we haven't even got the disease, why should I bother having the vaccine? But just think of that map with that red flashing, and we will at some point have those borders open and it will come to South Australia. And it might come before we even make a deliberate decision to have more leniency at the border. It could come tomorrow. I'm always looking at my phone, what's happened next? Have we got cases here? So we have a very short time to get as many people vaccinated, because once it's here, the people that are not vaccinated are going to get into serious trouble and get sick, and we don't want that. Now, this is a question we have been asked, can the vaccine give me COVID-19? Absolutely not. This is not a live virus vaccine. Some old vaccines in the past, polio used to use a live virus, but we don't use that. This is just not in the modern vaccine. So you cannot get COVID through the vaccine. Absolutely zip. We also have people ask, do they contain animal products? And so no, they do. The ones approved in Australia, they don't contain any fetal cells or animal, meat or egg products. What if I have food allergies? Now, certainly people have allergies, and you can have an allergic reaction to anything you eat, drink, or are injected with, or any sort of medicine. So my daughter has allergies and has an EpiPen. So when she had her Pfizer, the only thing, when she told them this is what I've got, they said, we'll keep an eye on you for 30 minutes instead of 15 minutes. So that was the only difference, and she had no problems at all. So when you get your vaccine, you will be having it in somewhere where you've got medical care. So for example, if you go to the Wayville Clinic, we have the paramedics there. They've got adrenaline. They'll treat you if you have an anaphylactic reaction. So all of the times when we give vaccines, we know this is a risk, and we make sure that the precautions are there. So if you're in Vishnu's clinic, he gives you the vaccine, he's watching you, oh my God, going a bit, not breathing well, Vishnu, he's going to treat you for it, okay? So we're aware of an anaphylactic reaction and we know how to respond to it. So that will occasionally happen, but it doesn't mean that you shouldn't have the vaccine. Now, this is a question that people have asked because of this mRNA technology with Pfizer and Moderna. Could it change your DNA? No, it does not change your DNA. The COVID vaccine, Pfizer and Moderna, have a small fragment of messenger RNA, so it's not DNA, but messenger RNA, and it tells your body how COVID works, and so it allows your body to respond, but it doesn't do anything with your DNA. So that is, again, ruled out. Yeah. No, it's a fragment. But if you don't mind, I would rather get back to you after the presentation to give you more detail. Yep. Because it's not large, but I can't tell you the exact size in proportion to the whole virus. Yeah. I think you must be a scientist. Oh, engineer, there we go. But you're asking really good questions, thank you. This is, again, an important question because many people in your communities will be in contact with their friends, colleagues, family overseas, and also will be using social media to get information in their own language. And they'll know that in some countries, there's mixing of different vaccines. Now, the reason we haven't done that in Australia is that there are companies, there are research and the pharmaceutical companies are actually doing trials of different mixing and different combinations because sometimes when you put two different ones together, you get an even bigger immune reaction, but you also potentially could get more side effects. So that's the reason why TGA and ATAGI have not approved that for Australia yet because those trials haven't finished and we don't have the results of them. So we want to be super careful here. We want to be basing the information we're providing to our public on the best available evidence. We know that it's happening, but we haven't got it all yet. So once we've got it all, it may be down the track that ATAGI will change its recommendations. The only time it's okay to do this here in Australia, we'd recommend it, is if you've had a bad reaction to one, if you've had an anaphylactic reaction to one, an allergic reaction, we wouldn't be giving you that same one again, obviously. So then we'd be recommending, your doctor would recommend have your second dose in a different vaccine. And we're lucky because we've now got the 3. Okay, this is again an easy question, but I'm sure you possibly have people in your communities who think that it's going to be expensive and avoid healthcare because of this. It is absolutely free. It doesn't matter whether you're permanent resident, you're an Australian citizen, whether you're a refugee, whether you're a newly arrived migrant, whether you're an international student, if you've got a Medicare card or you don't have one, we don't care. Anybody walking around Australia at the moment gets a free vaccine. That could be a seasonal worker that we're bringing in from Vanuatu. It doesn't matter. We want everybody to have that free vaccine. Now, Delta has changed things a lot for us. The Wuhan strain was much nicer. We wish we still had Wuhan, but unfortunately Delta is here. It is twice as infectious as the other variants, but fortunately the vaccine is still effective against the Delta. So those percentages I showed you were for the Delta variant. So that could be a reason for people's hesitancy. Oh, I don't think it's going to work as well because we've got Delta. If anything, we even more do we have to be vaccinated because the Delta strain is more infectious, but it causes more severe disease than the previous strains.
What about if this virus mutates into a different?
Yeah, this is a good question. Now, if the virus mutates into a different strain, we will have to see how effective the vaccine is. But the mRNA, the Pfizer and Moderna, the technology is such that it can be switched pretty quickly. Other vaccines may take longer to respond to a change in that variant of concern. Now, we are likely to get variants of concern when there's disease out of control, which is what happened in India, which is when we had the Delta variant. Because it is replicating, it's dividing so many times so quickly that it has a chance to change and get a biological advantage, and then that's how you get a variant. So actually to get out of this pandemic is important what we do in Australia, but we actually have to make sure we've got vaccine equity around the world, and there's lots of developing countries that don't have access to vaccines or the systems in place to get vaccines into people's arms. So until we actually all work together as an international, a whole world, and everybody's able to access vaccines, this is going to be a risk, and with these variants of concern. And so this is why we'll still be very mindful of the international travel and monitoring the variants as they come through. But the only way to stop it is actually not having the disease getting out of control. Yep. So this is actually one of the things when we get asked about boosters. It is in equity, so we could be looking at Australia for boosters and thinking we will all want 3 doses, And is that fair when some countries have nothing? So yeah, it's an interesting question. Actually, that leads on to the next question. Will we need an annual booster shot? So we don't know yet. We're watching the international situation. Some countries are moving to boosters, but it's particularly for people who are not good at making an immune response. And those will be people that have got a health condition where their immunity isn't as good as strong, but it will also be somebody who might be being treated for cancer and is getting medication that knocks their immune system. It's not dangerous for them to get a vaccine. It's really important for them to get a vaccine, but they might not have such their body might not give them that same protection. So those are the people that we think may need a booster shot down the track. But yeah, ATAGI is looking at all of that data. So I was reflecting, because I got my vaccine in February. I was the second, and Stephen Marshall was the first person, and the health minister was the third, and then the police commissioner was the fourth. So I'm probably, if anyone's immunity is waning, mine will wane first. So we'll just have to wait and see. And if we need to have a booster, SA Health will put the systems in place to allow that to happen, but we will have plenty of vaccine by that stage. It's been some problem getting enough vaccine, but we're now really ramping things up. It won't, I don't know, again, but it may be that by that time we'll have information on being able to mix vaccines. Oh, which one? I had Pfizer, because this was I was the first person with a mandatory vaccination, because I was just told this vaccine's in the state, it's the first one we've got, you're turning up at the Royal Adelaide at this time, blah, 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 there you go. So that's what I had. No choice. Was happy I had it. You'll watch me to see how I go, yes. So what are the long-term side effects? So most of the vaccine side effects that we know about happen in the first 6 weeks. But when you have any new medication, it's very important that you have the systems in place, or the surveillance system, so that you monitor it. And we have very good systems in place to monitor any long-term side effects. And as soon as we see something, again, it's reported through to the TGA. And this is exactly the same as all other medications. So as in this slide, since 2020, nearly 6 billion doses of the vaccine have been given around the world. And many countries have the similar way of monitoring for side effects. So at the very least, we should feel confident that it's being monitored very closely. Now, this is a question, are the vaccines mandatory? And you probably were looking like I was, feeling a bit sad when I saw all of those construction workers and the protests in Victoria. We do not want to have something happen like that here. We've been very lucky with our community. Everybody has been on board along the way with this. So we are trying to make sure, again, that the sufficient consultation occurs, and we really have to have good public health reasons for mandating. So here are some of the people where it is mandated. So residential aged care staff, contractors and volunteers, so anybody that's working in aged care. And obviously the reason for that is, now that we know that the vaccines stop transmission to other people, it's how we're protecting our most vulnerable elderly people. So that's now mandatory. Also mandatory for anyone working in the quarantine system in the Medi hotels or at the airport, coming in contact with international arrivals who have a higher rate of COVID. Now that they have a really hard job, actually. If anyone wants to thank these guys, they have a really hard job. They have to wear full PPE, they all have to be vaccinated, and they have to get COVID tests every single day. And even when they're on leave, they have to go and have follow-up COVID testing. And that's protecting us, that's been protecting our international borders. Then maritime workers have been included. And then since we've had the problem in ACT, New South Wales and Victoria, all of the essential travellers have to be vaccinated as well. And people might have known that freight drivers from the 27th have to have had their first dose of vaccine. So there are certain groups that have been mandated, but not everybody. And then the last one is, obviously in our hospitals, we have the sickest, most vulnerable people. So we have policies in our public hospitals about mandatory vaccine, and we'll be looking at that more broadly. I was talking to Vishnu as well about including GPs and other allied health in that as well in primary health care, because those are the people that are on a daily basis coming in contact with very vulnerable people. Yeah. Yeah. So one of the reasons why we stuck with residential is because when people are living in a residential facility, you end up passing it on between people, and it's like a sort of mini cruise ship in a residential facility. It's also the same in correctional facilities where people are in residential. So that's why we're focused on the residential as opposed to home-based. But anybody that's working with a vulnerable person, it is obviously much better if they're vaccinated. But at this point, we didn't want to go mandate. We just wanted to look at how would we phase this and how do we protect the most vulnerable people. Yeah. Oh, actually, just going back to that one, you will have heard of vaccine passports. You will have seen perhaps what Victoria's doing. I think I've got this right. If you're wanting to go to the hairdresser or a beautician, you are going to have to be vaccinated. We haven't thought about doing that here, but at some point, living with COVID, and if we have the disease here, we'll have to look at this as well, and what are the high-risk behaviours in our community where we can't do anything else. We can have our COVID management plans and we can have masks and such like, but there's nothing else, and we want to start having nightclubs and these sorts of things starting again. So we have been looking at vaccine passports in terms of those high-risk behaviours. Nothing further to announce tonight, but I just wanted to let you know that certainly we are looking closely at what other countries are doing, and it's going to be very interesting to see how these things pan out in Victoria. You'll be able to tell if someone is not vaccinated how long their hair is. I don't know. But anyway, it'll be interesting to see. Now this one we get a lot because we know that there's particular hesitancy in young women. There is absolutely no impact on fertility. So you can definitely have the vaccine if you're planning a pregnancy. And then moving on to the next one, you definitely can have the COVID vaccine if you're pregnant. The reason we didn't have this at the beginning was that when the trials are done, they never include children and they never include pregnant women. And that's why we had to wait for the real world effectiveness data from our international colleagues in the US and the UK, where they had such massive outbreaks. Everyone was vaccinated regardless of you being pregnant or not. And it was very clear that it's completely safe, like the flu vaccine or whooping cough. And in fact, for women who are not vaccinated, if you get COVID, you're 5 times higher risk of going to hospital, 2 to 3 times higher risk of needing ICU, and 1.5 times higher of having a preterm birth. So COVID is not good for you or the baby. And you can imagine why, because it affects your respiratory, your lungs, and you're growing this baby and you've got a higher demand for oxygen and fluids and such like, and then put COVID on top of it. It's just not good news at all. It's very similar to the flu during pregnancy. And then following on from this, can I have the vaccine if I'm breastfeeding? Absolutely, you can have the vaccine. In fact, the antibodies that your body produces go through your breast milk, and those antibodies go to the baby, and they actually get passive protection without even being vaccinated. So it's definitely fine on that one. Now, the next one is, I'm sure you know the answer to this, but can I get a vaccine without a Medicare card? Absolutely yes. We want everybody in Australia, 12 and up, to be vaccinated. You don't need Medicare card. You just do need some identification when you come and have your appointment. So that's an easy one. Now, how can I get proof of my vaccination record? There are instructions. And when I had my vaccine, it was so early on, there was nothing like this. And I still haven't worked out how to get it up on my phone. And my son, Hugo, had his on the weekend. I still haven't quite worked out how to get his up. But I'm told, Chris, you have yours? Yep. that it's fairly straightforward and you can get a copy of your vaccination record. I still have my little piece of paper that I've taken a photo of as a backup, but I'm sure you're all probably more clever than me and you'll be able to find it and get it on your phone. Have you had success?
Well, no, I actually have a question in regards to that. So obviously we talk about that you can get the vaccine without having any care.
Yes.
Which is fine. And I can see that you're talking about an individual health identifier, which I'm guessing is for people that don't have Medicare.
Yeah.
How do you go around getting one of those? So do you have to get it before you actually get a vaccine, or is it kind of...
This is where my knowledge is very poor. I'm going to be completely honest. Vishnu will help here. Seshu, sorry.
Easier if people get it before the vaccination. So wherever you're getting your vaccination, they upload the data to the Australian Immunisation Register. Then it links up and picks up very easily. You can still do it after, but it takes a little bit of a process.
Where do you get it from?
Sorry?
Where did you get it from?
What do you mean?
Where do you get the
number?
IHI from?
Oh, even people who don't have Medicare or not citizens who are visitors, they can go to the Australian Immunisation Register site.
Good, and I've learnt something too.
Once you get that, that is what will give you the passport and the details.
Yes.
On paper, if you have absolute difficulty, the GPs can give you where you have had the vaccination. So that's always
you get a
possible.
little certificate given to you.
Online. But
No, my
On the
son
card.
probably got it in my handbag. Yeah.
My mom just had her first.
Okay. Mm-hmm. Oh, your second dose.
certificate.
Now, the other thing I was going to say is that our Department of Premier and Cabinet are working on a vaccine passport that's linked to the MyGov app, which is the one that you QR check in. So that will be brilliant because then you'll just have the one thing to deal with. So we're hoping that that will come through in the next month or two. And when that happens, we'll let everybody know. Now, this is a tricky question. Will we be able to travel overseas and return when the vaccination rate is 80%? The states do not make decisions about the international borders. We have to quarantine people, but it's actually the Commonwealth that allows people to go overseas. Because of the issue with New South Wales and Victoria, to us, in effect, that's like an international destination because the rates of disease there are so high at the moment that they're actually higher than some of the other countries in the world. So that's what we're critically looking at in terms of our borders and how we will allow people to travel safely between those places. But suffice to say that we will be wanting people to be double vaccinated because that's just such an important way of protecting our community. So I can't tell you about overseas travel, but certainly if you're not vaccinated, your chances of travelling overseas are going to be severely diminished. Now, there are a couple of questions here about staying informed and how can we stop the spread of misinformation. These are really questions for you because you've got the answers here rather than me. These are your communities. And I can say that, you know, you're encouraging friends and family members to stay informed. I think one of our best resources is the SA Health website and the resources that Chelsea and her team have developed. There's also, again, TGA. So if you want the details, you can go to the TGA and ATAGI statements are there as well. And also the Australian Department of Health. But SA Health has done a lot of work getting resources translated into other languages. And in fact, the session that we had earlier today asked whether this PowerPoint could indeed be translated into different languages so that other people could use it in community sessions in their own language. And I think we'll be looking at doing that. And then staying informed. So this is some of the websites. So the SA Health, covid19.sa.gov, and then we've got a COVID vaccine website. There's the TGA website there, tga.gov.au, with the safety information. And then there is a variety of resources with translation. And basically that's where I come to the end, and I can't tell you how to work with your community because you are the experts. I think one of the most important things though is that your community will have lots of questions. I'm sure, not answered everything, or maybe not answered everything as fully as what your community would want or what individuals would want. And no question's a silly question. Seshu has a lot of experience because you sit and talk to patients every day. You know the sorts of questions that they ask. And it's very important that people are able to bring forward what they're worried about and what they're concerned about in any of those interactions that we would have with our patients. We are really keen to hear any ideas that you have working with your community so that we can support you from our end as much as possible with whatever resources that you need. So I'm happy to finish off there now, and we'll open up the panel for some more questions, Andrew. Thank you.
All right, thank you. We are going to open the floor to questions in just a moment. I'll just reflect on this final slide, which is you will get a copy of this, so please feel free to share the recording, which will have the presentation slides on it, and as we said, we'll look to provide even more resources to you. So here's just some information here, how you can, things you can do next. We'll also have the option to help you with your vaccine booking if you need out in the foyer later. So now what we'll do is we're going to open to questions. If you have a question, my colleague will have the microphone and you just raise your hand, stay where you are, and she will present the microphone to you. You don't need to touch the microphone for COVID safety reasons. She will hold it for you as you ask your question. So I'll hand it over now and put your hand up if you have a question.
What do you see the outlook for children younger than 12 getting vaccinations in the near future?
I was very pleased to have an email from Professor Caroline Miller, who works with us, and to say last night that Pfizer's released their data for 5 years and up to 12 years, but that will need to be looked at by ATAGI. And of course, that's the pharmaceutical companies now release that safety information, but it will need to go to ATAGI to provide advice about the risks and benefits in our population. So, yep, I think that that's coming. And of course, there are other vaccines. As I mentioned, Novavax is another potential vaccine down the track as well for younger children. Yep. So I think that there's going to be potential there.
Okay, thank you very much, Professor. I think I have a couple of questions. I will start asking maybe one by one.
I might pass them on to my colleagues.
Number one, I'm from Afghan community.
Yeah.
Lots of Afghan refugees coming from Afghanistan at the moment, and I've got a couple of questions from them in this regard coming here tonight, that's why. Number one, if they are vaccinated in Afghanistan during this period of time, are they going to be vaccinated here again, or what's the procedure?
Yeah, so we are going, the Commonwealth in particular is going through a process of having the vaccines that are available in other countries, because we want to make sure that they are as effective as the vaccines that we're giving here. And we also want to be able to recognise those vaccines and add that to our vaccine passport. So that is definitely being looked at. Yeah.
Okay. Thank you. What is the Pfizer's side effects, obviously? My question was actually, is there side effect for the Pfizer vaccine? But I think you explained that there is some minor side effect. I'm just wondering how long that can stay with the people. I mean, if someone has sore arms, that sore arm, where going to go away?
Oh, how long is the arm?
Yeah.
A very short period of time. So, it might just be 24, 48 hours. Yeah. So it's really just a local reaction as the immune cells are going in to look at this protein and work out what's going on, and then it disappears. Yeah.
So it is going to be longer than 24 hours. There's some problem, right? So they should.
They're all different, and we each have a different immune response. Here, over to Seshu.
We have had people having arm pain for 3 weeks.
There you go, 3 weeks.
Right? Sometime more without anything else. And, no swellings and things like that. So we observed them. We asked them to take Panadol and see how they go. Eventually they cleared up. So we have seen longer periods with vaccine.
The fact of, in our community again, there are lots of elder people who are not educated in their language, whereas the English, yeah? A lot of these people are struggling, honestly, because I'm working with the TV program. I think we are working together as well on some part of it to translate the language. But I can see the people, I wish Dr. Walid was here. We had a TV interview the other night in the community TV, obviously, and then we actually wanted to know what is the percentage of the community, especially elderly in our community and non-speaking English people, especially the people who are not educated in their language. But unfortunately, we don't have any sort of figure or measure to say, okay, this many people have been vaccinated and this many people will be vaccinated in future. Seeing our community, it is absolutely some sort of thing is lacking in especially for the elder of our community, the people who are not educated in their own languages. I want to suggest to you, I think this is before I suggested that Afghan community has a very good app at Jeb's Cross, which they call it Sunday Market. It would be good if there is any pop-up vaccination center there. I think that would help a lot. Thank you very much.
Thank you. Katina, did you want to say anything about the numbers?
Look, I think that you've brought up a very important point, because to know how effective you are, you really need to know how well we're going. We are limited with the immunisation data that we get from the Commonwealth on the registry, and unfortunately it doesn't include, country of origin or language spoken at home. So that really puts us at a bit of disadvantage, really. But what we're hoping to do going forward is to have conversations with people such as yourself with the idea that you've just brought up, where a pop-up would be useful. If SA Health is doing those vaccinations, we will have an idea of how many people were vaccinated. And it's really in that kind of local health way that we can get that more detailed information that we need, rather than relying on what's going to the register. But we would be keen to speak with you. And the piece of paper, the survey thing, if you can fill in some of those details so that we can reach back out with you in the next week.
Thank you for your talk, much appreciated. My questions are relating to the past, the present and the future, so I'll just have a go one by one. Regarding the present, I was just curious. We talk about the recovery rates of people who are vaccinated. When I did my contact tracing training at the Communicable Disease Control Branch at Adelaide Uni this time last year, we were curious and wanted to know what was the recovery rate of people who were unvaccinated at the time, given that was the situation, and we were told it was about 95%. Do you have any updated clarification as to what those numbers may be to those who want to know?
So the question is, how have people recovered with COVID now? Yeah.
Without a vaccine.
Without vaccine. And do you mean the people that were infected last year?
Yes.
Yeah. So there'll be a group that have, unfortunately, have long COVID. I can't give you the stats on that, but there's certainly a couple of researchers at Adelaide University that are following that cohort through. And I can't just remember their names off the top of my head. But the issue is with Delta is it does cause more severe disease. I think that we'll really be needing, it's almost like a different virus, and we'll have to be seeing the outcomes from Victoria and also New South Wales in terms of people's long-term recovery. Yeah.
And in relation to the long-term effects, when will we be in a position to actually understand with clarity what the long-term effects will be? Because as far as I'm aware, even though this is an approved vaccine, we're still in a clinical trial phase in some aspects of the world.
Yeah, so that's, as I said, we are lucky that we've got good surveillance. The alternative is that we don't have a vaccine and we don't vaccinate ourselves, but then we would be in an absolutely terrible situation with the disease. So it's just one of those no-win situations. It's just something that we're going to have, unfortunately, but the most important thing is that we've got systems in place to pick up any of those long-term side effects.
Can I? That in, and just to add to what Nicola was saying, we know that we do this surveillance system for even the old vaccines. So this is not something that has been set up just for COVID.
Yeah.
It is normal good practice of a vaccination program. And just to clarify, you said, oh, we're still in the clinical trial. We're not in the clinical trial phase for those for whom we are offering the vaccine. But for the younger people who are actually still in the trial phase, that's different. So, yeah.
Yep. Yeah, thank you for clarifying. No, we're not, I certainly didn't sign up to a clinical trial. I just signed up to getting vaccinated. Yeah.
Yeah, I did have one more question. Professor, you mentioned, thank you for your responses, by the way, much appreciated. You mentioned in response to the future that there's not going to be not one single solution that's going to help us get through this. Out of curiosity, and I myself am not from a medical background, but I was curious, for example, in America, they're looking at different approaches as to what else they can do in addition to vaccines to arm themselves against this particular situation. And I heard there's been some preliminary discussion about potential drugs that may become available in the future that can be used in conjunction with this vaccine to ensure an efficient and effective recovery. One of them, for example, is known as Regeneron. So I was just interested in terms of the future, what is the preliminary discussion that's going to be in terms of how we're going to respond and discuss future solutions in addition to the ones we currently have?
So I'm working in public health. I'm all about prevention because I think prevention is much better than a cure. So talking to my clinical colleagues, there's no silver bullet around the corner for treating COVID. We still are very experimental with many of these medications, and so preventing yourself getting it with a vaccine and also those other pillars of prevention, really basic public health measures, hand hygiene, etc., we just need to be using those. So really it's interesting. It's good to see that the scientists are putting their heads together, but much of the treatment in hospitals is supportive therapy. So supporting people's breathing, giving them fluids and the like. I think I'll just remember prevention is better than a cure.
Hi, I'm Sue McNamara from Australian Red Cross. We work predominantly with temporary visa holders, and I appreciate the information you've provided tonight for people who don't have Medicare, which we've known, it's excellent. The trick is, I think there are a couple of little barriers. So one, for example, when I got my second jab a couple of weeks ago, I got a text message to remind me, wonderful, it said, please bring your Medicare card. Great for me, but if I don't have a Medicare card and I read that, I think, oh, maybe I can't get it. So it's just a little bit in the messaging maybe. And the other thing is, it would be really helpful if we had a step-by-step sort of process in a few maybe key languages around how people without Medicare can get a vaccination passport. So you referred to that tonight, but if we had that documented, that we could then provide that to our clients, that would be really helpful. Thanks.
Good idea. I think Chelsea was seen madly scribbling that one down. Thank you.
Thanks.
Thank you for the presentation tonight. So I'm from a community that is not really well represented in South Australia. We're only about 1,000. But, you know, we don't have any translated medical information from SA Health. So I was just wondering, you know, all the translations, is that based on statistics about, oh, we've got a big Italian community or we've got a big Afghan community? And if, community leaders wanted to get in touch to ask for translations or, collaboration, how can we do that?
Well, my suggestion is you write on that sheet that you've on your seat. But Chelsea, did you want to make a comment here?
We've got information translated into 35 different languages, and we know that that's not all of them. We certainly do, and we appreciate that. That's based on a list determined between SA Health, some multicultural non-government organisations and multicultural affairs, and not just based on the numbers. It's based on the numbers of people living in South Australia, but also the numbers of people who may not speak English. So yes, there's lots of Italian and Greek people living here, but lots of them do speak English. So absolutely happy to take what language is needed and what community needs to be represented from you and work with you on that. The availability of translators in South Australia and South Australia is quite limited though.
Could I ask you what community, out of interest? Romanian. Oh, I'm sure we can find translators for you.
Oh, for the camera, okay. The camera is not pointing at me.
Turn it around.
I know there were plenty of translations. I think the problem is they don't reach communities. If you could, when there is a new translation, if it would be good if it could be mailed like information about this information session was. I think reached a lot of communities. I can see here some familiar faces. Because some of the translations pretty quickly get outdated. Like some early translation mentioned 2 vaccines, now we have 3 vaccines, maybe more. And now we have Delta variant with more symptoms. So if you could get it through emails, perhaps, then we can spread it in our communities. And just question to organize of the meeting, would it be okay if you send to our community this presentation as a whole?
Yes,
okay?
I think that's the intention.
Thank you. Thank you for the presentation today. I just want to know what is the breakthrough infection percentage and how many deaths are resulting from the infections? Have you got any data with that?
So just say...
Breakthrough infections?
Like breakthrough infections. Well, if you think about those stats that I put up in terms of those are people that have got the infection but then have reduced symptoms. So it's around about, I was just trying to think because I didn't put the stats up about the impact of actually not getting infected. It's around about 70% and then or 60 to 70%, and then of those people that still get infected, there's a reduction of them passing it on of about 65%. So even if you're vaccinated, you still have about a 40% chance of getting infected, but it's much less severe. Does that answer? Yeah.
And one more thing, with respect to AstraZeneca, earlier days it's been restricted to only 60 and above. Now we are recommending 18 plus. What changed it?
So basically, when we knew about this clotting disorder called TTS, it's not related to the other form of clotting, which is very common. So people might know about DVTs, clots in the leg, which is very common. This is completely different. It works in a different way. And it is specifically associated with AstraZeneca, and it is very rare. When we were finding the cases in Australia, and we were very good at picking it up because they'd already recognised it in the UK, so we were looking out for it. We knew which blood tests we had to do. So we probably picked up a lot of mild cases that didn't get picked up in other countries, and those people were treated very quickly. So what we learned was that people who tended to get TTS were younger and they would get it more severe. And that's why because we had Pfizer as an alternative, we said, okay, for people 40 and below, we prefer Pfizer. My husband was getting pushed by me, go and get your vaccine, go and get your vaccine. So he went and had AstraZeneca. My mum had AstraZeneca. And then the ATAGI keeps looking at the data because this is what they do. They want to make sure that they're giving the best accurate information with new data coming in. They said, actually, we'll change it to everyone less than 60 is recommended to have Pfizer as preferred. But there are many people in Victoria and in New South Wales who are younger. My daughter's only 22. Many of her friends have gone and got AstraZeneca. It's not wrong to have it because they couldn't get Pfizer and they were scared of catching COVID because they're living in ACT. So there were many younger people in New South Wales that have had AstraZeneca very successfully. It's worked extremely well. So now, a couple of weeks ago, I knew that there's a group of 60 plus who did not want to get AstraZeneca. They were just not going to have it. And I thought, we now have enough Pfizer in our state. It's best I just open it up to everybody and everybody can have a choice. Then no one's complaining or sending me emails asking for this, that and the other thing. Yeah. So there's nothing wrong with having AstraZeneca at any age, 18 and up, but that rare side effect is higher in younger people. Yeah.
Thank you.
The system and the measurement for the home quarantine, how we do about it, because we got there so much catchment everywhere, but how we measure it.
How we measure it?
Yeah, how we got the system to cover.
Yeah. So do you mean when we? So with do you mean with the home quarantine app that we've introduced, or?
Yes.
Yeah. So South Australia's been working on developing a way that we can have people safely quarantining at home. So from a public health point of view, in terms of disease spread, I'm interested to make sure that the person stays at home and doesn't have friends to their house. Okay, so with the app, what it does is we have our staff in the department, automatically a ping comes through to your phone and we ask you to answer it, and we do the geolocation and check your facial ID and do the check. All fine, they're where they're supposed to be. So that's, and we also have people needing to be tested and we check on the compliance of the testing. The other part of home quarantine is that we've got to make sure people are not getting sick and they're not getting stressed and they're not getting, mental health problems, and that we're looking after them because we've put them in quarantine. And so the other thing that happens with the quarantine app is that we check symptom checks and we do checkups for people using the app as well. So there's two things that we do with the app. Yeah.
Because now we hear that Pfizer is vaccine wears out after about 6 months. So I hear from some of my friends, they said, "Oh, I wish I didn't have Pfizer. I wish I had AstraZeneca." So I think
no one's happy.
Yeah. I think it's good to give people choice. Let them choose. So what's happening with AstraZeneca? Does it sort of works longer because it's DNA vaccine, or?
Yeah. So the AstraZeneca is actually got a virus vector. It's an adenovirus vector. So it's just a different technology. Again, the data's not in really. There's been some early suggestions that the immunity is going to last longer with AstraZeneca versus Pfizer, but there's nothing concrete about that yet. So look, I thought Brett Sutton, my counterpart in Victoria, had the best thing. He said is the best vaccine for you is the one that you can get today. And if you're in the middle of an outbreak, basically, he's right. So we can go, oh, look, I think this is better on this, blah, blah, blah. But I think we're really lucky that we've got such effective vaccines, and we've now got Moderna as well, and it's going to be available for everybody. So I think that's really the bottom line, yeah.
Yeah. Sorry. Thanks. That was a great presentation. Useful. My question is around vaccine availability. Currently, vaccine is available through booking. A number of my community members who wanted my help with booking, we go to the website, some places, the GP or any other place, the earliest appointment is late October, early November, etc. So when will we get vaccine become available without appointment?
It's likely we'll be allowing more walk-ins over the coming months, particularly, or coming weeks really. So the clinic we opened up at Paraka started today. They will allow some walk-ins. There's the Maya Centre, level 3 of the Maya Centre in Rundle Mall allows walk-ins. So you'll see more of that happening. From a logistical point of view, when you're trying to vaccinate a large number of people, having bookings is much easier, so we don't have a whole long line up down the street. It's much more efficient to have bookings, and we get people through in a really safe and efficient way. But you'll see more walk-ins become available as we've had higher percentages of our population vaccinated. Now, look, I think people should just grab the booking, even if it's October or November. And what you do is you keep refreshing and you'll find other appointments open up and you can get in sooner. So my daughter in Canberra, she's like, Mum, I can't get in until mid-October. I said, just book it, then keep looking at the system. I know they'll get more vaccines in and they'll open up more bookings, and it's right. So she managed to shift it back for 4 weeks. She did have to spend a bit of time, checking, and she managed to shift it back. If you're going to do that, make sure you cancel your other appointment just to make that available. But many people have been able to shift their appointments forward. Yeah.
Just to add to that, it'll be good to know for you guys that the GP clinics that are doing the vaccination have got increased supply from 1st of October. So you'll suddenly see more appointments opening up. We do about 300 a fortnight, and we are going to 900. So it varies from clinic to clinic.
I'm so sorry, everybody. We have run out of time, and I know there are a couple more questions. So feel free to ask any more questions you have on your sheet, or you can come and talk to one of our panelists when we finish. So please do leave your survey sheet on your chair, and we'll collect it when you've left. Take any more brochures you need from the foyer. If there are any languages that are missing, let us know. Please do put any suggestions you have on your feedback sheet, and look out for the email that we'll be sending you with a copy of this presentation. There is also some food at the back which is still there, and some water, so please help yourself to that. And last of all, can you please put your hands together for our panelists tonight? Thanks everybody for coming.